In today's fast-paced world, many of us are familiar with the overwhelming stress and anxiety that life can bring. But for some, this stress escalates into something far more intense and frightening: a panic attack. Panic attacks can strike anyone, anywhere, often without warning, leaving individuals feeling helpless and confused. In this video, we will explore the science behind panic attacks, uncover their causes, and discuss effective ways to manage and overcome them. Whether you've experienced one yourself or know someone who has, understanding panic attacks is the first step toward reclaiming control. The science of panic attacks. Panic attacks are sudden episodes of intense fear or discomfort that typically peak within 10 minutes. They activate the body's fight or flight response, flooding the system with adrenaline and other stress hormones. While this response is essential for survival, it becomes problematic when triggered unnecessarily. Symptoms of a panic attack include rapid heart rate, tachycardia, shortness of breath or hyperventilation, sweating and chills, trembling or shaking, a sense of detachment or unreality, derealization, fear of losing control, going crazy, or dying. Physiologically, a panic attack begins in the amygdala, the brain's fear center. When the amygdala perceives a threat, it signals the hypothalamus to activate the autonomic nervous system, releasing stress hormones. This cascade prepares the body for immediate action, but can cause significant distress when there's no actual danger. Causes and triggers. Panic attacks often seem to come out of nowhere, but they are usually linked to specific underlying factors. These include biological factors. Genetic predisposition plays a significant role in the development of panic attacks. Individuals with a family history of anxiety disorders are more likely to experience them. Additionally, imbalances in neurotransmitters like serotonin, norepinephrine, and gamma-aminobutyric acid can increase susceptibility. Psychological factors. Cognitive distortions, such as catastrophizing or hyperfocusing on bodily sensations, often contribute to panic attacks. People who are prone to anxiety may misinterpret normal physical sensations, like a racing heart, as signs of an impending attack, creating a self-fulfilling prophecy. Environmental triggers. Stressful life events, such as the loss of a loved one, job changes, or financial difficulties, can act as triggers. Trauma, particularly from childhood, is another significant risk factor. For some, even specific settings like crowded places or confined spaces can initiate a panic attack. Medical and substance-related triggers. Certain medical conditions, such as thyroid disorders or cardiovascular problems, can mimic panic attack symptoms. Stimulants like caffeine, recreational drugs, and withdrawal from certain medications can also provoke episodes. Impact on daily life. Living with panic attacks can be debilitating. Many individuals develop agoraphobia, avoiding places or situations where they fear an attack might occur. This avoidance can lead to isolation, disrupted relationships, and difficulties maintaining employment. Over time, the fear of the attacks themselves becomes a significant burden, creating a vicious cycle of anxiety. Diagnosis. Diagnosing panic attacks involves a comprehensive assessment by a qualified professional. The Diagnostic and Statistical Manual of Mental Disorders defines panic disorder as recurrent, unexpected panic attacks, followed by at least 1 month of persistent concern about additional attacks or significant behavioral changes. Treatment options. Fortunately, panic attacks are highly treatable with the right interventions. The most effective treatments include cognitive behavioral therapy. CBT is considered the gold standard for treating panic attacks. It helps individuals identify and challenge distorted thoughts, develop healthier thinking patterns, and gradually confront feared situations through exposure therapy. Medications. Selective serotonin reuptake inhibitors like sertraline and fluoxetine are commonly prescribed for panic disorder. Benzodiazepines, such as lorazepam, may be used for short-term relief, but are not recommended for long-term use due to the risk of dependence. Lifestyle modifications. Regular exercise, a balanced diet, and adequate sleep can significantly reduce anxiety levels. Mindfulness and relaxation techniques, such as yoga or progressive muscle relaxation, are also beneficial. Support groups and education. Joining a support group can provide a sense of community and reduce feelings of isolation. Understanding the nature of panic attacks empowers individuals to manage their symptoms more effectively. Coping strategies. During a panic attack, in the moment of a panic attack, grounding techniques can help individuals regain a sense of control. Deep breathing. Inhale slowly through your nose for 4 counts, hold for 4 counts, and exhale through your mouth for 6 counts. 5, 4, 3, 2. 1 technique: identify 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste. Positive self-talk. Remind yourself that the attack is temporary and not life-threatening. Visualization. Imagine a calming place, such as a serene beach or forest, and focus on its details to distract your mind from panic. Preventing panic attacks often involves a combination of strategies. Regular therapy, stress management techniques, and consistent routines can make a significant difference. Avoiding excessive caffeine, alcohol, and stimulants is also advisable. Additionally, practicing daily mindfulness or meditation can help reduce baseline anxiety levels. Real-life stories of overcoming panic attacks. Hearing stories of others who have successfully managed panic attacks can be a source of hope and inspiration. For example, Case 1. Sarah, a 29-year-old teacher, used CBT and daily mindfulness exercises to reduce the frequency of her panic attacks. Over time, she regained confidence and resumed her favorite activities, such as hiking and traveling. Case 2. Mark, a 42-year-old business executive, discovered that regular exercise and reducing caffeine intake significantly improved his symptoms. Combined with therapy, these changes allowed him to manage stressful work situations effectively. Alternative and complementary therapies. In addition to conventional treatments, some individuals find relief through alternative therapies. Acupuncture, stimulating specific points on the body, may help regulate the nervous system and reduce anxiety. Herbal supplements, natural remedies like chamomile or valerian root can have calming effects, though it's essential to consult a healthcare provider before use. Art therapy. Expressing emotions through art can provide a therapeutic outlet and reduce stress. Common myths and questions. Myth: panic attacks always require medication. Fact: while medications can be helpful, many individuals manage panic attacks through therapy and lifestyle changes alone. Question: can panic attacks cause permanent damage? Answer: panic attacks themselves are not harmful, but chronic stress can impact physical health if left untreated. Conclusion: panic attacks, while terrifying, are not insurmountable. Understanding their origins and learning effective coping strategies can transform fear into empowerment. Remember, you are not alone, and help is always available. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit. Together, we can spread awareness and support those in need.